Just ahead on American Black Journal, we're going to talk about racism's impact on African American health and what it takes to bring about change, plus a conversation on including more diversity in the arts. And a new hip-hop music video encourages people to wear masks during the pandemic. American Black Journal starts now.
From Delta faucets to Behr paint, MASCO Corporation is proud to deliver products that enhance the way consumers all over the world experience and enjoy their living spaces. MASCO, serving Michigan communities since 1929.
Support also provided by the Cynthia and Etzel Ford Fund for Journalism at Detroit Public TV.
The DTE Foundation proudly supports 50 years of American Black Journal in covering African American history, culture, and politics. The DTE Foundation and American Black Journal, partners in presenting African American perspectives about our communities and in our world.
Also brought to you by NISSAN Foundation and viewers like you. Thank you.
Welcome to American Black Journal. I'm Stephen Henderson. Michigan Governor Gretchen Whitmer has officially declared racism a public health crisis in our state. Under her executive order, a Black Leadership Advisory Council is going to be formed to take a look at the ways that laws perpetuate racial inequities, and every state employee is going to undergo implicit bias training. I spoke with Dr. Kimberlydawn Wisdom of the Henry Ford Health System about racism's impact on African American health. So let's start with this declaration itself, which I think is very significant. I think it's very important that the governor has declared racism a public health crisis. But as someone who works in public health, I imagine it lands on your ears a little differently. So tell us what your reaction was and is to this declaration.
Well, I was actually delighted to hear when the governor made the declaration about racism as a public health crisis, in part because we know that health disparities have been persistent, they've been profound for a very long time, and core to that are elements of inequities that are at a systemic and a policy level, which I can go into more detail shortly. But COVID-19 has actually exacerbated or illuminated the clarity that these health and healthcare disparities are very, very significant. So for those of us that have been working in the field of addressing health and healthcare disparities for decades, this is not new to us. But that the governor actually took a stand to say that it's a crisis, which means it requires focused attention. She's at a level of urgency. It's so critical if we're going to truly close the gaps, because the gaps existed long before COVID, but it just shows her the intentionality that she has around closing these gaps and basically, realizing these gaps are not acceptable. And we have to identify ways to very systematically close the gaps, because the gaps have been created by systems and policies.
Yeah. Let's talk about some of the outcomes that you see from these inequities, the kinds of things that African Americans live with and endure because of the public health crisis of racism.
Well, Stephen, when I started my career some 30 plus years ago, we were not sure. Many of us that were, in the field of medicine, in the field of public health, we sensed that there were clearly disparities, but we didn't have the data, we didn't have the information. And about 2002, a landmark book came out called Unequal Treatment. And in that document, it clearly delineated that the disparities that we see are profound, they're persistent, And when we control for or account for socioeconomics, income, preference, insurance status, those disparities persisted. So it was very clear then that we had to approach this in a very different way in terms of closing these gaps. It wasn't typically the confounding of a socioeconomic condition or people's preferences, that it was clearly something that had to be approached in a very different way. So now, where we are now, it's very clear that we can do something much more substantive, and that's why the governor's effort is so key, because healthcare cannot fix these disparities that we've seen with COVID, these healthcare or health disparities that we see. It can't be fixed by healthcare alone. It's got to be fixed by multiple sectors of our community, and that's why by the governor establishing this council and calling it, a crisis, then she actually can rally multiple sectors to the table to systematically and very sustainably close the gaps that we see.
When we talk about implicit bias and the training that the governor wants all state employees to have, talk about the ways that that plays out in the public health arena.
Absolutely. So the element of implicit bias that we actually call unconscious bias, that's those biases, those stereotypical behaviors that people may, or stereotypical thinking that people may have that they're not even aware of. It's kind of blind spot thinking. They've been exposed to many negative portrayals of people of color, so they have a unconsciousness around that bias. But what happens is that leads to, and some even think, to sort of unconscious racism, where people are not aware that they're, perpetuating policies or practices that may disproportionately impact communities of color. And let me just give you an example related to COVID. And I must say, I'm so proud of the frontline workers, the first responders, the leadership, the health department. I mean, so many people have done fabulous work related to COVID. But yet there were things that happened that were that occurred that were not intentional at all. So, for instance, when we think about where the testing sites were, or individuals that didn't have a car, perhaps, so much of the initial testing, you needed to have a vehicle. And so those biases, they were trying to keep people safe. So all the intentions were honorable, but yet you've got to look at things through a different lens, and you realize there were unconscious biases that went into play. You had to have a doctor's prescription, a car. Those sorts of things, a lot of people that were disproportionately adversely impacted did not have. So these are unconscious biases, but they lead to unconscious impacts that lead to, significant death in our communities, high case counts as well. So that's just an example where nobody intended to, great people, yet the outcomes were devastating in some circumstances.
So talk about, from your perspective, the upside of the potential here. I'm one of the people who's always a little bit skeptical of committees and panels to solve big problems. But from your perspective, this declaration and the things that are happening as a result of it, what do you imagine could change, and could change maybe even in the near future?
Well, that's a great question, because I think what could change is that we begin to move upstream. So mind you, when we look at health and healthcare disparities, those are sort of downstream elements. You say, well, what has caused the health and healthcare disparities? Well, there's social determinants of health, which are jobs and education and housing and food and transportation. So that's what's caused those health disparities. So if you move a little further upstream, you see, well, what's caused those social determinants of health or social needs? Policies and practices. So what could happen is there could be changes in policies, changes in practice that actually would impact hiring, educational opportunities, housing opportunities, jobs, transportation, and then ultimately those downstream elements like health disparities or diabetes or COVID cases and deaths, then those could be, the outcome related to those would be much more favorable. So you've got to move upstream, and that's what this declaration, the council that she's talking about establishing, has the opportunity to move upstream, not just look at those people that, the cases of COVID, but you've got to look at why. When we think about it, housing, people could not socially distance because they did not have the housing capacity that others. And then you look at transportation, as I mentioned in the previous example. People need opportunity for jobs. I mean, you know, jobs that can pay so they can afford housing and food. Opportunity to quality education. So we've got to move upstream, and government is one place because they can convene many key stakeholders to moving upstream and ultimately to policies and practices, because we are where we are because of policies and practices that were put in place many decades ago.
The governor's executive order also calls for the promotion of cultural arts in the African American community. A new report from the Knight Foundation and the Urban Institute found that Blacks in Detroit have a harder time accessing the arts than whites do. As a result, people of color feel less connected and engaged in their communities. Knight's Detroit program director, Nate Wallace, recently wrote an op-ed emphasizing the need to break down racial barriers to the arts. That includes hiring more African Americans at cultural institutions. I talked with Nate about how to create a more inclusive arts community. The Knight Foundation and the Urban Institute recently did a study about the importance of arts in connecting communities and found some, maybe not surprising, but pretty glaring racial disparities.
Yeah, the report was commissioned, and we found that Blacks did not have as much equity or as access to the arts as whites. And in this moment, where we all have a moment to just kind of pause and reflect, I thought it was important to talk about it. And one of the things that's absolutely been important to me is the arts, you know, in my life. And the op-ed was actually based on a Facebook post that I did in 2014, where I actually saw this mother and her son, you know, have this moment in front of this Kehinde Wiley piece. Mm-hmm. And the son, you know, seen this piece called Officer of the Hussars, and he looked up the piece and he looked and he said, you know, why is he there? And the mother literally just, it was really casual. The moment was maybe 5 to 7 seconds, but the mother said really casually, because he's supposed to be. And I thought that was such a profound moment, especially in a time right now where we're all kind of forced to kind of do some introspection within ourselves. You know, we've had this moment. There is no sports. There are no outside distractions that's kind of taking us away from the moment that we're in, this moment of uprising. So we have to wrestle with the fact that there is gross inequities, you know, in our city, you know, and I don't think there's anybody more prepared for this conversation than our institutions, than our museums, than our art institutions. The conversation is literally on the walls within these institutions. So, you know, we need to have those conversations. So the piece was pretty much framed by that experience.
So that Kehinde Wiley piece that's in the museum is also one of my favorites. I think it also signifies some of the diversity that we have been able to achieve in terms of at least the collection at places like the DIA. We have that piece, we have the Bearden that's there, we have both African and African American galleries at the museum, and yet there's still some real criticism being leveled at the museum for its inclusivity and the arts community more generally. Talk about the things you see that represent disparity, even in the face of the progress that's represented by Kehinde Wiley or Bearden in the DIA?
Well, I think that specifically Kehinde Wiley, his work is framed around Black bodies being in positions that they're not commonly used to being seen in. So while I think that the DIA and MOCAD has done some really great things, while I think that Ford produces a really great car, at the same time, if there's a protest going on within those institutions, we got to look beyond the exterior. We got to look beyond these really front-facing things and really get to the heart of it. One thing that Detroit is an 80% Black city. And while we're talking about diversity, while we're talking about inclusion, and while we're talking about equity, we have to lead these conversations. We have to lead these conversations. We have to push these conversations. And it's uncomfortable. And, growth is always uncomfortable. And, it's a hard conversation to have. But at the same time, I love our museums. And I think that one thing that James Baldwin said, and I'm probably gonna get this wrong, but he said, "I love America, therefore I have the right to critique her perpetually." And I love the DIA, I love MOCA, I love our institutions. And therefore I think that it's our right to actually critique them and make them better.
Yeah. I mean, it's really our responsibility.
Absolutely.
In addition to our right. So talk a little about the role of philanthropy, I guess, then in trying to push that and trying to push our institutions to think more about themselves and think more about how they fit into this narrative of inclusion and equity.
Yeah. So one of the things that I'm really excited about, and I've been in this position for maybe about 7 months now. So it's been a wild ride in my philanthropic career coming in at this moment. Yeah. So one thing that we're really thinking about is how do we include equity in every single piece of grant making work that we do. Even though our work is not based around racial equity, how do we make sure that racial equity is included in the DNA of what we do? So how do we make sure that our grantees have a diversity strategy? How do we make sure that Black leadership is being given the capacity to actually carry out the mission of the organizations? How are we scaling up those individuals who may not necessarily have the budgets to support $100,000? Where are those organizations at that have a $50,000 and less budget to do the work that they need to do, and how are we thinking about them? So these are just a couple of the things that we're thinking about as we kind of do our work, and equity is just embedded in our Detroit strategy going forward.
Yeah. When you think about the arts institutions we have here in Detroit, you were talking about the opportunities for each of them to do better. Is there an opportunity, though, to have even a bigger conversation among and about those institutions, I guess looking more at systemic change as opposed to individual?
Oh, absolutely. I think that we're in this moment where we have to like you said, I think that we have to rethink everything. I think that while we're, during George Floyd and the protests and the racial uprising and kind of the global consciousness of America as it's kind of raised up, I think that we have to be prepared for these type of conversations. So, like I said, I think that there's no better institution than our institutions to have these hard conversations. There's already, like you said, there's already a Romare Bearden on the wall. There's already Kehinde Wiley on the wall. So the conversation is already on the walls. We really just need to have that collective conversation between leadership and community and figure out exactly what we need to do and how we need to do it.
Yeah.
Go ahead.
I was going to say, you're somebody who's really involved in the arts community here. Is it your sense that the leaders of these institutions and the communities that surround those institutions are prepared and ready to kind of embrace this, or do we still have just the barrier of unwillingness in front of us?
I don't think it's unwillingness. I definitely don't think it's unwillingness. But that's something I don't know yet. I think that you have two very different problems at two institutions. One, they've already moved forward and they're looking for a new executive director that's going to steer them. Yeah, MOCAT, they're going to steer them in a different direction. With the DIA, I don't know. I don't know yet. I think the jury's still out. I know that they're doing some internal work to see exactly where they are and how they're going to move forward. So we'll see.
And finally, we're going to leave you with a look at a new public service announcement that encourages people to wear masks to help stop the spread of COVID-19. The PSA is a music video, and it's produced by the New York nonprofit Hip Hop Public Health. And it features Raheem DeVaughn, Dougie Fresh, and Daryl DMC McDaniels. The song is called Behind the Mask. Stay well, and we'll see you next time.
Let's beat this. United. The love life way. Together. It's a symbol of love, a symbol of trust between us. I wear it for you, you wear it for me. Promise. I put on a mask out of respect for the masses and all those left behind. To salute and honor all the first responders battling on the front line. All the goodwill people. If you got my back got your back. Oh, behind the mask. I believe. What's to ask? So let's save the world. Behind the mask. What times that you feel alone? Just know you're not invisible. 'Cause I still see you behind the mask.
I see you, I feel you.
Now we can't pretend the state that we're in not dangerous. 1 minute we're close, then 6 feet away like strangers. There's a virus outside threatening all our lives, and we can't let it in. Not just for you, but for all. To prevent a loss, we put on the mask for them.
Come on, y'all.
If you got my back,
I got yours.
got your back.
You got mine.
Behind the mask, I got your back.
Here we go.
What's to save the world?
That's right.
Behind the mask. And if
Listen.
you feel alone,
Come on.
just know you're not invisible.
We in this together, y'all.
Still see you
I see you.
behind the mask.
I feel you.
I see you. I see you. Still see you.
That's
See
right.
you behind the mask.
And I feel you.
Here we go.
DMC.
Here's a little story about this year. Who would have thought we would end up here? New decade, we was barely in it. New year came with a world pandemic. It will get better, the storm will weather. Heads held high as we stand together. Gotta do our part to stop the spread. Gotta pull together, don't be misled. Wash your hands, make sure they're clean. 20 seconds or more if you know what I mean. Put a mask on, it don't matter what kind. The cloth surgical or the N95. Before you take your mask off, go wash your hands off. Roll it outside so you can keep the germs off. Start a mask in a paper
and I'm with you all the way.
Yeah, I still see you behind the man.
Ladies and gentlemen, this is real right now. Raheem Devon, DMC. My name is Doug E. Fresh. Please wear those masks.
From Delta Faucets to Behr Paint, MASCO Corporation is proud to deliver products that enhance the way consumers all over the world experience and enjoy their living spaces. MASCO, serving Michigan communities since 1929.
Support also provided by the Cynthia and Etzel Ford Fund for Journalism at Detroit Public TV.
The DTE Foundation proudly supports 50 years of American Black Journal in covering African American history, culture, and politics. The DTE Foundation and American Black Journal, partners in presenting African American perspectives about our communities and in our world.
Also brought to you by NISSAN Foundation and viewers like you. Thank you.